Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos. In this video, we're going to discuss the topic of understanding HIPAA and HITECH. In my personal opinion, this is one of the most misunderstood parts of doing any type of distance counseling or working with clients in an online environment. And so we want to do a reminder in this video, a reminder of what HIPAA looks like and what's expected of you when it comes to HIPAA, and also look at HITECH and how that affects you in your counseling practice if you're seeing clients online or even on ground for that matter. So first of all, we want to ask the question, what is the difference between privacy and security? Sometimes we use those words interchangeably, but the reality is those are two separate things. The privacy rule sets the standards for how covered entities and business associates are to maintain the privacy of protected health information. And throughout this rest of this presentation, we'll be using the acronym PHI for protected health information. So the privacy rule is basically the standards on how that you're going to go about keeping people's information private. So that's the standards. The security rule defines the standards which require covered entities to implement basic safeguards to protect electronic protected health information, which is called EPHI. And so the main difference you see between these two things is privacy rule is for, once again, that's for the privacy of protected health information. The security rule is for electronic protected health information. They're going for something else we'll talk about in this training a little bit, and you'll hear just in general, is this term HIPAA secure versus HIPAA compliant. And this is where this comes into play. A lot of places will talk to you about software that is HIPAA compliant. The problem with that is there's no such thing as HIPAA compliant software. Compliance comes with you following the rules we're going to talk about in this training. So you as an individual can be HIPAA compliant, but the software that you want to look at needs to be HIPAA secure. And so we want to go back to the security rule for that definition there. And so kind of keep that in mind as we go through this training today, as we talk about HIPAA security and also the privacy rule as well. There's no difference between the two there. One is for the privacy protected health information. The other one is for electronic protected health information. And know the difference between the two, because there's a difference between privacy rule and the security rule. So first of all, what is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act of 1996. And this is a federal law that each of us should be somewhat familiar with. If you've ever gone to a doctor's office in the past, since 1996, you've had to be able to sign some type of informed consent that helps you to understand what that you know what the HIPAA compliance looks like. And so HIPAA is a response by Congress to healthcare reform. It wants people's private information to be protected so it cannot be misused or used in an incorrect manner. And so HIPAA is going to affect the entire healthcare industry, regardless if you're a dentist, a mental health professional, a doctor, whatever the case may be. If you're in the healthcare industry, you're going to find out that HIPAA is something that you need to know about. And because of that, HIPAA is mandatory. And so I felt it was very important for us to have a conversation about HIPAA so we can get a better understanding about it. Because if we don't understand it well enough, there's some fines and penalties that you can be charged with, which we'll talk a little bit later on about. But if you don't know about those, then if you're not aware of those, then you can find yourself in a lot of trouble. So we want to talk about how HIPAA is mandatory and some things that you need to do as we work on being HIPAA compliant practitioners when it comes to people's private health information. So when it comes to HIPAA, it just protects the privacy and security of a patient's health information. So this goes to look at how we look at keeping the client's information and to what means and measures we use to protect client's information. It also provides for electronic and physical security of a patient's health information. And we're going to talk a little bit more about what exactly of type of health information needs to be protected. We also want to look at prevents healthcare abuse, healthcare fraud and abuse, to make sure the clients aren't being taken advantage of, especially when you're using information that they want to be protected, whether it's a social security number or whatever the case may be. We want those things to be protected. And so this helps prevent fraud and abuse. It also simplifies billing and other transactions, reducing healthcare and administrative costs. That if individuals are following after HIPAA and what HIPAA asks of them, it makes the whole billing process a lot easier for us to go through. And when it comes to us making transactions or talking to other individuals about information we've collected from clients, this just gives some great guidelines that we can follow and to go by. So the question then becomes, who must follow the HIPAA law? Once again, this is a law. This is a federal law, so this is not something that you can kind of opt out of. And so any type of insurance plans, if you work for an insurance company, then you have to be following the HIPAA law. If you're a healthcare provider, whether you're a mental health professional, a doctor, a clinic, a hospital, nursing home, pharmacies, anything that in the healthcare field, you are required to follow HIPAA. And so many of you have been to doctors and you've been to the offices where they give you this form that you need to look at that shows that you understand HIPAA. And so that's one thing you want to make sure you're mindful of, that we are required as mental health counselors to know this as well. Also, healthcare clearinghouses. Maybe you're doing your own billing, or you're in private practice, or you work for an agency. Someone does the billing for your insurance whenever you take insurance. And so those clearinghouses, those people who have the diagnosis of the clients you're working with, they once again need to follow HIPAA law. And also, HIPAA also applies to covered entities, business associates, entities that provide data transmission of PHI on behalf of a covered entity, and that requires access on a routine basis to that private health information, are considered to be business associates under HIPAA. Health information organizations that facilitate the exchange of electronic PHI primarily for treatment purposes between and among several healthcare providers. And so that's a lengthy paragraph there, so let's break it down a little bit. It says HIPAA is going to apply to covered entities. We're going to talk about covered entities in a minute here. Business associates, we'll talk about that in a minute as well. So these are people who have access to your client's information. Anyone that provides data transmission, or maybe you're using some type of video software and you're transmitting client information through that mode, then you have to have they need to follow HIPAA law. Anybody has regular access to any type of client information, they need to know HIPAA law. And so that's why it's important for us that we don't take HIPAA lightly, because for some of us, it's almost like ethics sometimes. We know what the ethics are, and sometimes we don't follow them because we think, well, it doesn't really matter to me. Well, HIPAA is kind of the same way. Some people will look at it that way and think, well, this doesn't really apply to me, but the reality of it, it does apply to you, and there are steep consequences for not following through with HIPAA and the laws that it seeks to carry out. So what are some covered transactions when you consider private health information? Enrollment and disenrollment. So if a client's calling in and you're signing them up for counseling sessions, and you get the client information, they've officially enrolled with you. That information is now private health information. When they're leaving treatment, maybe you're writing a letter for them that says they're being discharged, or whatever the case may be, and they're disenrolling from therapy. That is also a covered transaction under HIPAA. Also, premium payments. If they're making payments to their insurance company, that's going to be covered under there. When we call to check the eligibility for if you're in a private practice and you call and check eligibility for your clients, once again, that's private health information. Referral, certification, and authorizations, health claims, healthcare payments, and remittance advice. Anytime you're working with insurance companies and talking about the clients being in therapy, these are all covered transactions that need to make sure they're done in a HIPAA secure way through the use of HIPAA by you being HIPAA compliant. And so these are just some covered transactions that we need to make sure that we are covering and being considered about. So next question then becomes, what is a business associate? It brings that term up a few minutes ago. Business associate is any organization or person working in association with or providing services to a covered entity who handles or discloses personal health information or personal health records. And let me break that down and give you an example of that. Let's say, for instance, that I have someone coming into my office and they are, I have a Coke machine here in the office. And let's say, for instance, they're filling that up once a week. Well, they are now considered a business associate because they're going to come in contact with my clients. If my clients are sitting out in the lobby there, they're coming in contact with them at all times. And so they may know private health information about the client. Their name, things of that nature, is private health information. And so the fact they know who these individuals are, they automatically become a business associate because they're working with my counseling center that I have. And so we have to figure out a way of making sure that the information they know does not get disclosed in an improper manner. And so a business associate can basically, like this is saying, any organization or person that's working with you and they handle or has the ability to disclose personal health information or personal health records. And so that can be a lot of individuals when you think about it. And so what HIPAA law says, that in order for us to work with that, we need to make sure we have a business associate agreement. And what a business associate agreement is, this is a contract between a HIPAA covered entity and a HIPAA business associate. And this contract protects personal health information in accordance with HIPAA guidelines. And basically what this HIPAA, or what this business associate agreement does, you get them to sign off on it, and it helps them to be able to say, well, basically what it's saying is that they're not going to disclose any information that they have received because they're in association with you. And so if you look at the end of this training, there is actually a sample copy of a business associate agreement that you can look at and maybe modify for your business. But you need to make sure you have one of these signed if someone comes in contact with any of your personal health information for your clients. So whether it's the software you're using to keep your client data information, whether it's a video software that you're using, anytime someone's coming in contact with your client information, you need to make sure a business associate agreement is signed with them. So for example, I use video software to connect with my clients. And so because of that, I have a business association agreement signed with that video company so that whenever I meet my clients in an online environment, I know that that company is not going to disclose information to anybody else because they've signed this business associate agreement, and I keep a copy of that. And so this is a practice that many individuals need to get into the practice of making sure they're having these business associate agreements. So I think a lot of people know about them, but not a lot of people are actually using them. So making sure that you get a signed business associate agreement with anyone who has client contact information or has the ability to use that. So then we got to think about what patient information must we protect. And so once again, the PHI, or the protected health information. This relates to past, present, or future physical or mental condition of an individual, provisions of health care to an individual, or payment of care provided to an individual. And I like how it says past, present, or future. If I know somebody's coming for a session in the future, once again, that can't be disclosed because it's protected health or health information. Or if I'm not their therapist anymore, and there's somebody from the past, HIPAA still comes into effect because it's still protected health information. And so because of that, this is very serious for us to realize that just because someone's not a client anymore, that doesn't mean that they still don't have the ability to talk about the information. It means we don't have the ability to talk about the information without some written informed consent, which we'll talk about here in a few minutes. But that protected health information, it has to be protected. If it's transmitted or maintained in any form, electronic, paper, or oral presentation. So if you are using an electronic health record, it's going to be important for you to know that information has to be protected. If you're still using paper to write your notes on and you keep in the filing cabinet, you need to make sure that's protected. Or orally, once again, you need to protect that information of the client. anything that identifies or can be used to identify the individual. And it's important for us to realize that, that it's very easy sometimes to identify an individual client, even when we're not trying to do so. And so you may think that you're doing it vague when you're doing it, but the reality of it is you got to make sure that if you're talking to anybody about your clients, if you don't have written permission to talk to them about them, maybe you're doing consulting or whatever the case may be, you do everything you can to protect their health information. So I'm not going to give their name, I'm not giving their address, I'm going to maybe even change some of the symptoms that they're showing or whatever the case may be. And the purpose of it is to protect the client's information in order for me able to get consultation on that. So the protection of health information is once again extremely important in this whole process. So some example of protected health information: simply the person's name, and we talked about that a little bit at the beginning here. They know that the person who comes in to fill up your Coke machine or whatever the case may be is some type of vendor. If they know that person's name, they know that you're coming to a counseling center. Just them knowing their name alone is protected health information, and so we want to once again make sure that we keep that protected. Their address, we want to make sure that's protected as well. The street address, the city, zip code, anything like that, that type of information needs to make sure that is protected. The name of an employer, even the place they work at, that becomes protected health information. You may think, why is that such a big deal? Well, you may work in a town where a lot of people work for the exact same employer, and so you may mention an employee that works at this certain company, and it may end up being a small company as well. Many people may know who the individual is just by the information you give about them. And so the name of that employer can give away who the client is, so that's protected. Any date, their birth date, their admission date, their discharge date, any dates at all, that's considered protected health information. Telephone numbers and fax numbers, if any type of numbers you have for that client, once again, I want to make sure I keep that protected. Also, emails, addresses, we want to make sure we keep those protected in some type of secure form, because once again, that's protected health information. Obviously, on the next one, so the social security number, we want to make sure that's not getting out, or any medical records at all. And so this slide right here gives you a pretty good example of some of the information that you want to make sure that your client is protected for your client, so it's not getting out with other individuals. So these are some good examples of protected health information. When a person has this, when you have this protected health information, you need to have some type of authorization. And this is something the client will be signed, or somebody who can give permission for the client. And so what you have to do on this piece of paper, you have to describe how the PHI is going to be used or released. And so on that release information or the authorization that they sign, you need to tell them how you're going to use the information. Are you going to sell the information to somebody else? Are you going to be using it for research? Whatever the case may be, they need to know that exactly. Also, identify who may use or release the PHI. If you work in a private practice and more than one person has access to your records, they need to be able to know that. If you have a biller who bills for you outside of your agency, then the client needs to know that as well, and know that identity, that person has access to the information. Also be able to identify who may receive the PHI. Maybe you're working with their doctor, and you're going to obviously get a release of information signed there. You want to make sure you identify and make sure they know exactly what person has access to it. I've seen sometimes where people maybe do school-based counseling, and they'll do a release, and they'll have a release for the entire school. It just says like, oh, this public school district, and has that as the entire on the release information. And that's not specific enough. You want to make sure it's specific to the individual who you'll be working with at the school, because if you have a release for an entire school, then you're basically saying the janitor, the cafeteria lady, whoever that individual is, has access to that client's records. And that's not very specific. So you want to make sure you identify who that is. Also, once again, describe the purposes of the use or disclosure of the information. Identify when authorization expires. For many people, the authorization will expire 1 year from the time they signed that authorization. I've seen authorization before where it's 1 year from the last time you've seen the client. It's going to vary a little bit, but make sure you have some type of authorization, and it's very specific on when that ends. And this also has to be signed by the patient or someone making healthcare decisions for the patient or client, however you refer to the individuals you work with. And so this needs to be something that is signed. And so with the software that I use, this is something that goes out electronically. It covers all this information in that, and they do electronic signature. That way I have that on file. So you want to make sure you have something on file that shows that you have authorization to be able to release their private health information, and specifically who that's going to go to. Also, HIPAA requires that you give each patient a notice of privacy practices that describes how you plan to use and share his or her protected health information and a patient's privacy rights, and request every patient to sign a written acknowledgement that he or she has received the notice of privacy practices. Once again, if you've gone to the doctor, you are used to those. The notice of privacy practice is a separate sheet that they have. You can Google those, and there's plenty of those you can find on the internet for free. And basically what that notice of privacy practice is something they will sign that says that they understand, once again, how you plan to use and share their protected health information, and that they know what their rights are. And so every patient must have one of these signed forms in their chart. And so when it comes to the rights, this is what it looks like. They have the right to request restriction of the PHI uses and disclosures. So the client does have the ability to say, you know what, I will give you information that you can use, but you can only use it and I restrict it to only certain people. They have the right to do that because it is their information. Or the right to request alternate forms of communication. Maybe you're on an electronic system and they want to have access to their records, or if they want to communicate with you in a separate way. Sometimes clients will allow you to leave voicemail messages for them or on their phone, or mail to a post office box versus a physical address. They have the right to do that, but they have to request that on the forms of communication under this patient rights. And so they have the ability to do that, even though you may not be comfortable with it. If the client wants it and they sign off on it, then you're able to do that for them. And the right to access and copy patients' private health information. Once again, in the patient's right, they have the right to access the information that they have, and to get copies of that information. Also, the right to an accounting of the disclosures of private health information. So every time you disclose their private health information to somebody, then you need to be documenting that, and the client has the ability to know how often that is that's occurring for them. And also the right to request amendments to this information. If you decide you need to amend anything when it comes to their private health information, they need to be able to have access to that as well. And so the patient rights is something else they need to have signed. Also, when it comes to the client patient health information, that you want to make sure this is a general practice refrain from discussing PHI in public areas. Whether you're out in the hallway or with a colleague, maybe on an elevator somewhere, or you're out in public, whatever the case may be, you want to make sure you do to not discuss the PHI in any type of public areas. Because once again, you're putting their information at risk. Also, when it comes to medical support staff, they need to take care of sharing PHI with family members, relatives, or personal representative of patients. And information can't be disclosed unless the patient has had opportunity to agree with or object to the disclosure. Now, obviously, if the client is a minor, and depending on the state that you're in, this may change a little bit. But in general, if the client has not signed anything that says you can release information to their family, then you cannot release information to their family. And so once again, you might want to check with your state laws on that to see whether or not you are able to do that. But in general, you're going to have something signed by that client that gives you permission to be able to release information. Also, personal representatives are those individuals who are able to make healthcare decisions on behalf of the patients, and this is where minors come in. Individual, you may have two individuals where they may not even be married or anything like that, but they may have a right of attorney to this individual's client records, and so they have the ability to be able to sign off and on their healthcare decisions. So you're able to release information to them. And so once again, just make sure you have great records of knowing who this client has given you the ability to talk to. Also, who you have the ability, who has the ability to release the client's records and things of that nature. Just be very careful with that. That way, you're not getting out information that does not need to be out there. Another thing is the question we have to answer is, why is protecting privacy and security important? And the reason is we all want our privacy protected when we are patients or clients. If I'm going to the medical doctor, if I'm going to see a therapist, then I want to make sure my privacy is protected. It's the right thing to do. So I'm going to do, as the adage says, I'm going to do unto others like I won't done unto me. So I'm going to make sure that I keep other people's information, privacy protected, just like I want mine protected as well. And so because of that, I'm not going to be careless or negligent with any type of private health information in any form. And so that's something that I'm expecting out of my healthcare providers, and my client should be expecting the exact same thing out of me. Now, there are penalties for breaking whenever you do have clients' protected health information and you end up giving information out in the wrong way. There are penalties for that. For some violations, for the first violation, it shows that it can be $100 per violation. If you end up doing that same thing, the identical violation, more than one time within a year, it's a $25,000 fee. If you wrongfully disclose their information, that can be $50,000. Up $100,000 and up to 5 years in prison for wrongful violation of obtaining PHI under false pretenses. That could mean, logging into and looking at client information that you shouldn't have access to, at the $100,000 fine and 5 years in prison for that, or $250,000 and 10 years in prison if committed with intent to sell or transfer for commercial purposes, personal gain, or malicious harm. So, say for instance you were upset with a client, and you wanted to get back at them, and you decide you want to post their client information online to embarrass them because in your case notes you remember something embarrassing that they did or what they said, and you put that on social media or release the information. You could be facing 10 years in prison or $250,000 for doing that. Or if you just want to sell the information, like their email addresses, things like that, for your own personal gain, once again, you can be there are steep penalties for that. So it's important to make sure to realize that not only is it the right thing to do when you keep that information private, but the problem is if you don't do that, there's steep penalties for ignoring it. So we've talked about penalties already. So now we want to transition and start thinking about what is electronic PHI or ePHI. So ePHI is electronic protected health information, and it's computer-based patient health information that is used, created, stored, received, or transmitted by using any type of electronic information source. And so if you're using any type of distance counseling technology, then this would be something obviously important to you. This is information in an electronic medical record, patient billing information transmitted to a payer, digital images and printouts, information when it is being sent by or to another provider, a payer, or a researcher. And so the big difference between the ePHI and the regular PHIs, we're talking about specifically electronic health records or electronic protected health information. So the question then becomes, how do we protect ePHI? So we want to ensure the confidentiality, integrity, and availability of information through safeguards, and this is what we call our information security. So we ensure that the information will not be disclosed to unauthorized individuals or processes, and this is where confidentiality comes in. We also want to ensure that the condition of information has not been altered or destroyed in an unauthorized manner, and data is accurately transferred from one system to another. This is called integrity. and also to ensure that information is accessible and usable upon demand by an authorized person availability. And so as we go through these next few slides looking at HI information, keep the words of confidentiality, integrity, and availability in the forefront of your mind so we give you a better understanding of what we're looking at here. So some security reminders we want to continue to think about is to make sure we password protect our computers and devices. I think people are pretty good with doing passwords on their computers, their work computers. I think that's something you should be changing anywhere between every 30 to 60 days. I will be changing your passwords. That way you can make sure your client information stays protected that way. But a lot of people use their phone when it comes to transmitting or electronic protect health information. So one thing I always tell people to do is make sure they have some type of alphanumeric password on their phone. Just a 4-digit code simply is simply not enough, and so we want to make sure we have an alphanumeric password for our phones. I think that is very helpful, and it makes it a lot harder for someone to break into your phone. Obviously, keeping make sure you're backing up your electronic protected health information in some type of secure manner. Keeping your offices secure. Don't have client records sitting out. Obviously, having your computer shut down when you're not using it. Locking up your office. Those are some things I would consider. If you have any portable storage devices, then you make sure we keep those locked up as well. Something that you always want to make sure you're doing is on a regular basis to run antivirus and anti-spyware software on your computer. That way it keeps that protected from anybody breaking in and getting information they don't need. And also make sure you're encrypting your PHI. There's different type of softwares out there, whether it's through email or your phone, different things like that, where they do come with encryption built into that. And those are the type of things I'll be looking for and when it comes to software when you're protecting your client's ePHI. So HITECH, an overview of HITECH is that HITECH is also a part of the American Recovery and Reinvestment Act of 2009. Just like HIPAA is also a federal law that affects the healthcare industry. The biggest difference between HIPAA and what HITECH does, it extended HIPAA through certain obligations to business associates and imposed a nationwide security breach notification law. And this is the big piece of it, is that the national wide security breach notification law. We're going to talk a little bit about that. So one of the biggest changes in HITECH is this, once again, the federal breach notification law for health information. And many states have data breach laws, so you want to make sure you check what your state has to say about it. But state laws typically only pertain to personal information. So if if there's a breach and people get into your client's personal information, you have to make the people aware that has happened to them. And we're going to talk a little bit about what that looks like. And so there are some HITECH breach notification provisions. It says the law requires covered entities and business associates to notify individuals, the Secretary of Health and Human Services, and in some cases the media in the event of a breach of unsecured protected health information. This is a pretty big deal here. Not only do you have to notify the individual if their information has been breached, but also you have to get in contact with the Secretary of Health and Human Services, which is on a federal level, and in some cases you're going to have to get an alert with the media if something happens. I've seen situations before where the counseling agency, someone decided they want to get rid of some client records. So instead of shredding those client records, they went to a dumpster out behind the building and threw all the client records away. And then somebody found those client records, and they had access to people's phone numbers, the social security numbers, information like that, and they literally had to go on to the TV and to let people know through media that their information could have been accessed. And so it's important for you to realize that this HITECH law, HIPAA, it doesn't take away anything from HIPAA. It puts more teeth on HIPAA and makes it a lot stringent when it comes to when breaches have been going on, that notification has to happen. So here's some of the breach notification provisions. When it comes to unsecured protected health information, this relates to past, past, present, or future physical or mental conditions of an individual. How we talked about a little bit earlier. So even if this is something that's happened in the past with the client, if it's going on right now, even if it's something that's going to be going on in the future, if it's in the client record and it gets out in the wrong way, then you do become responsible for that. And so it's possible that you have broken the HIPAA and HITECH rule on that. If you're transmitting this information, any kind of electronic, paper, or oral representation is being transmitted and there's a breach there, then once again there has to be some type of notification sent out. If any type of identifying information of the client gets out, you have to be able to get to let people know. So once again, names, addresses, name of employer, telephone number, the medical records, social security numbers, anything like that, that is what is going to those are things that can get you in trouble if they're gotten out in the wrong way. And so with this information, the information has to be encrypted. If you're using a cloud server or anything like that, your information has to be encrypted, or you need to shred or destroy that information to make sure no one else is able to get in contact with information. And so HITECH once again makes it a lot stronger. It's a lot stronger of a law there because there's some different penalties that go along with it. So what constitutes a breach? This just means any time there's been acquisition of information that's not presented by the HIPAA privacy rule. So I've heard of therapists before where their laptops are stolen and the patient health information is on there. That's considered a breach. Maybe you have a receptionist who's not authorized to access client information, and they look through their client files just for their own personal information, just because they want to find out stuff about that person. That is considered a breach. Or maybe the receptionist gives the discharge paperwork to the wrong client as they're leaving that day. Once again, a breach has occurred. Or the billing statements containing PHIs mailed or faxed to the wrong individual, then once again we have there's been a breach has happened there. So this is important for us to understand what a breach looks like and make sure that if there is a breach, then we gotta make sure we treat it in the right way. And so the question then becomes, and this is a question you have to kind of struggle with and you have to ask yourself is there a significant risk of financial, reputation, or other harm to the individuals whose information was used or disclosed? So say, for instance, someone's diagnosis gets out. Can that hurt their reputation? And if it can hurt their reputation, then once again, that there's been a breach. Maybe someone's social security number gets out there and their address gets out, and someone can now steal their identity. They're put at a significant risk of financial harm. That is considered a breach. But if someone's getting into the information who should not have access to it, then we see that their breach has occurred. Now there are a couple of different examples or exceptions to a breach that we need to consider. Sometimes there can be unintentional access that people have for information. Let's say, for example, an billing employee receives and opens an email containing client information by a client, which the receptionist mistakenly sent to the billing employee. They open up that email and read it and realize, hey, this is not intended for me. They delete it immediately. They let the receptionist know that. The receptionist documents that this has happened, and they move forward. Well, obviously, since they are a billing person, they should have a release of information already, not a release of information, but a business associate agreement already signed. And because of that, this wouldn't be considered a breach because that person deleted it immediately. It didn't go outside of their agency, and it was simply by mistake there. And so that could be an exception to a breach there. Or someone inadvertently discloses client information to a authorized person that's actually covered or is a business associate in this. So say, for instance, you have a doctor who works in a hospital and he gets once again accidentally given the wrong client information for a client that does not belong to his, that does not a client of his or a patient of his. They've seen the record of information. They look at it. They give it back to the person immediately. Lets them know that since that physician is a part of that agency and they do have they've signed a business associate agreement, or they're just a part of the release information, then they have not a breach has not occurred there, because even though it was done on accident and it was not purposeful, the person did not do anything with that information, and so that was inadvertent disclosure, and that would not be considered a breach. That'd be an exception to a breach. But if there's a covered entity in good faith has believed that an unauthorized individual has been disclosed information, there's a possibility it could be a breach. And here's an example where it's going to matter. For example, on the explanation of benefits that you may send out to a client. Say, for instance, you are sending out the explanation of benefits for someone you're seeing in private practice for their coverage or whatever the case may be. And you send it out, and it goes to the wrong address, and it's returned back to you as undeliverable. Well, no one saw that information. It was returned to you because it went to the wrong address. It's not been opened up. There would not be any issue there because a breach has not occurred, because no one who was not unauthorized was able to see the information. But say, for instance, somebody does open that up first and then looks through it and everything, or it goes to the wrong person, now a breach has occurred. And so even though the situation just changes a little tiny bit, a breach has occurred there because the wrong person has access to the information. And so you want to make sure that that'd be something that would be reportable there. And so I know those are a couple quick examples, but I think the thing that helps you out a lot is look at this decision tree for a breach notification. If you start in the top right-hand corner, it asks, number one, is this information private health information? Is it that name, address, phone number, social security number, things like that, employer's name? If the answer is no, then no notification is due, and no breaches has occurred. So you're good there. But let's say, for instance, that it is PHI. Then you go yes, and you will work your way through this chart. And if you find yourself going all the way down to the bottom right-hand corner, where this decision tree helps you see that there's been a breach, then a notification has to be done. There has to be something sent to the individual, something has to be sent to the Secretary of Health and Human Services, and if it's a huge breach, it may be necessary for the media to get involved with that as well. And so I think this is a good decision tree to use when it comes to a breach notification, because it helps you to have a visual picture of, if this happens, then this is what you do next when it comes to a breach of information. Now, on this slide, what it does, it looks at the minimum privacy violations actions. Now, here's the issue with it. Even though on the first bar, in the first section on the left-hand side, it says an accidental or due to a lack of proper education. Even though this was accidental, even though the example may be something we might not think is really, really big, and the action that your employer could take may not seem small, it does not mean it comes without penalty. We're going to show you on the next slide what it looks like, what the penalties could look like. But for example, say for instance someone does something accidentally or due to a lack of proper education. So an example could be improper disposal of the private health information. They don't do it in the right way. Maybe they thought they could shred it. They shredded it the wrong way, or whatever the case may be, or they just left it out to be shredded and never got shredded, so one was able to see it. Well, that's improper disposal, and so there could be some retraining and reevaluation, but that does not mean that there would not be a penalty to go along with that. And then sometimes there's purposeful violation of privacy. The individuals do, and this chart tells you in the middle on some examples of that. And then on the right hand side, that once again retraining will probably need to be done. Some warnings can happen with your employer, or warnings need to occur. But also there can be potential harm to clients in the bottom part there, and it's on a purposeful violation. And this is when you disclose or sell private health information to any source, and that could be a reason for termination. And so these are just some good things if you're running an agency, or if you're even in your own private practice. Just give you some things for you to look at when you consider when it comes to privacy violation actions. Here's some the different levels of them, some examples of what that looks like, and some different actions you can take to help remedy those issues if they were to come up. Now, we talked about what those look like. Now let's look at some of the disciplinary actions and some of the civil penalties. Just like with HIPAA, HITECH has some financial things that you will have to take care of if you're found in violation of breaking HITECH. And you notice these are tiered. They start from low level all the way to highest level. This first one is what some people will call the ignorance law. That's not the official name, but it's what that's referred to sometimes. And this is when the entity didn't, even though somebody used reasonable diligence, they just still did not know they did something wrong. It still can be a minimum penalty of $100 per violation. If it's repeated more than one time that year, it can be up to $25,000 and a maximum penalty of up to $1.5 million annually. If we find it a situation where there's reasonable cause, but it's a not willful act, anywhere from $1,000 up to $50,000 if it only happens once, and then $100,000 to $1.5 million if it's done more than once. If it's willful neglect but it's corrected within 30 days, we look at $10,000 to $50,000, or if it's done more than once, $250,000 to $1.5 million. Or if there's willful neglect and it's not being corrected at all, you can start off at $50,000 for one time doing it, or $1.5 million for minimum penalty. And notice there's no maximum penalty. Though that's a situation that you don't want to be in. So it's important for you to know what HIPAA and HITECH expects from you. So as a reminder to you, do not disclose private health information without patient authorization. If you have a question about whether disclosure is permitted, go back to that. The guideline that we gave you a little bit earlier, you might want to ask a supervisor or ask another colleague, but talk to someone who knows about privacy and health information. That way you can be practicing in the right way and treating your client's information in the best possible way. And just as I've talked about before, I want my private information to be treated with in a very private way. I want the exact same thing for my clients as well. Well, I do hope that this information helps you to understand a little bit better about HIPAA and HITECH and what those expectations are for you. I know it's not the most exciting topic in the world, but I think it's a very important topic for us to cover because it will give you a better understanding of what is expected for you if you're dealing with client information, which you are since you are a therapist. Hope this has been helpful to you.